They are the only game in town. Hundreds of thousands of people across southeastern North Carolina rely on Novant New Hanover Regional Medical Center for care in a medical emergency.
But in recent months, the hospital has struggled to keep up. And WECT's investigative reporter Ann McAdams has looked into the issues, and the hospital almost lost its Medicare contract over this.
John, yes, patients have complained for months about excessively long wait times, but things came to a head when a 77-year-old cancer patient coded in the emergency room lobby after waiting 5 hours for care. She died a couple of hours later. Patients, nurses, and now the state treasurer say it all boils down to money and large hospital systems putting profits over patients.
A pain in my stomach so bad I couldn't do anything.
When John Bridges' stitches failed after a recent surgery, his doctor told him to go to the emergency room immediately. Bridges had no idea what he was in for.
And I said, I had surgery, I'm actively bleeding, and it was just kind of like, okay, go have a seat.
Bridges had a tear in his GI tract and for the next several hours made trips to the bathroom in the ER lobby, trying not to make a mess while he waited for help.
I waited about 3 hours before I got taken into the back to be seen. And at that time, when the nurse is trying to draw my blood, I don't really have a lot of, it's not coming out. There's like really no blood pressure to speak of. I passed out in the chair, but not from having my blood drawn, just from lack of blood.
When he came to, he needed to use the bathroom again, where he lost more blood. That's when the doctor arrived. When Bridges took him into the bathroom to show him just how much blood he was losing, the doctor realized how serious the situation was. Bridges was already concerned about his own experience when he heard a woman died in June after waiting even longer than he did to be seen.
The more I think about it over time, the more frightening it becomes to me, because what if I have to go back to the hospital? What if someone that I care about or know has to go back to the hospital?
Many nurses from the hospital have contacted our station with the same concerns. They say they are being asked to care for many more patients than they feel they can safely handle and worry someone will die on their watch if the problems are not corrected. Cindy Bodie finally had enough and left her nursing job at New Hanover Regional in December. She says she's speaking out on behalf of many of her overworked former coworkers who are scared of losing their jobs if they talk.
You get tired of having to stay late, never being asked, can you stay late, just today? After a while, it happens every day, you get sick of it. Can you stay late? Nobody asks if you can stay late. You have a family. You can't even make a phone call and call them and let them know, I'm going to be late. I can't pick my kid up at preschool. What are you supposed to do? So there comes a point where you need your money, but you can't take it at the same time.
The hospital has been losing nurses right and left. New Hanover Regional had a 32% turnover rate last year. That's meant even more work for the employees who remain. Huge pay disparities have also contributed to the record burnout.
When you don't get treated well and someone at the top makes more than you, maybe they have more responsibility. But when you start to feel it every day, it does a number on your brain. And it eventually permeates the whole staff and everybody, and then everybody's negative. And all the negativity leads to everybody being negative. That permeates to the patient care, and that makes people want to leave.
Bodie says people go into the field of nursing because they want to help, and when they don't have the resources to do that well, it's demoralizing. While nurses and even doctors have been reluctant to publicly challenge executives getting paid millions to run Novant and other large hospital systems, State Treasurer Dale Folwell isn't backing down. He knows there are nursing shortages causing backups across the country, but notes these problems were not happening when New Hanover County owned the hospital.
I'm concerned about the lack of competency. I'm concerned about the lack of transparency. And what really needs to happen here is Novant needs to divest itself of this gem of a hospital called New Hanover Regional and put it back into the hands of the community and have people run it who aren't laughing, the multimillionaires who were laughing all the way to the bank when this transaction got approved.
Folwell has called the large hospital systems cartels, disguising themselves as nonprofits, and says they have far too much control.
Them controlling the supply of health care is a con on the people of this state. And the fact is that the reason there may be wait times is they control the supply of health care. They want to control the supply of health care. They don't care about the wait times in the emergency rooms.
Hospital executives take exception to Dale Folwell's comments. Coming up after the break, I sit down with New Hanover Regional Medical Center President Shelburne Stevens and other top executives to hear their reaction to Folwell's concerns and get other answers you've been asking for. Ann McAdams, WECT News. Before the break, we told you about some issues at New Hanover Regional Medical Center that have created big problems this year. Excessive wait times in the ER, overworked nurses, and claims by the state treasurer that Novant Health is putting profits over patients. Then, this summer, a 77-year-old woman who'd waited over 5 hours for care lost consciousness and had no pulse in the ER lobby. The hospital initially downplayed the details surrounding her death, insisting she did not die in the ER lobby. I sat down with hospital executives to get some answers. For people who wonder if we were misled by the hospital saying that she didn't die in the lobby, even if that's technically true, if the general gist of the story was fair, how would you respond to people who feel like we were lied to?
I don't feel that we lied to anyone. I think we gave you the facts that we had at the time. And actually, since that time, the family has asked us not to talk about the case at all.
We asked, and I guess probably we just asked too early. We asked, have any state investigators been here? And at the time we asked, they hadn't. They came the next week and they stayed for a week, and it turned out to be a pretty big deal. But how can y'all let the public know that you can be trusted?
We provide great service, and we've had some back steps this summer, we know, with staffing, and we're going to do everything, and we're committed to getting that care right and serving this community going forward.
We come to work to take care of the community and the patients that come to see us. I mean, that's where our heart is, and that's where our team's heart is. And so we have no intention and do not want to lie. You know, we talk about how we receive feedback. That's how we get better. I mean, we want to address anything that comes up that we need to improve upon. And we get that from talking to our patients, to talking to their families, to, you know, the state visit.
Some people are like, well, why didn't they tell you when the state did come to investigate? Why didn't Novant mention that we are in jeopardy of losing our Medicare contract?
That's just not our normal process. I mean, the state's been at New Hanover before, even since I've been there prior to this, on complaint investigations, and we've just never notified anyone. We get focused on their survey and any findings that they may find and improvements that we need to make when they come.
When push came to shove, when y'all got threatened with having your Medicare contract canceled, a lot of nurses got hired quickly. Tell me about how that was made possible. Did dollars just become available because they had to become available for y'all to continue to function, or what changed?
You know, we made some decisions in May based off of the knowledge that we had, and quickly learned that we did not retain some of the travelers that we were counting on retaining. And we did not convert all of the hires that we had planned on hiring. So we had already started that process, and so as the community sees that this happened very quickly, because you can't get travelers in very quickly either, but as we got them in quickly, it was because we were already in that process of bringing on additional travelers. Now we did, you know, in conjunction in July and August, we did bring on a third agency actually called FastStaff. That does bring in a little bit faster, but we were already in that process of bringing them on.
Dale Folwell, the state treasurer, has been an open critic of not just Novant, but large hospital systems. He has strong language. He's called these hospital groups cartels. He says it's a joke that they consider themselves to be nonprofits and that they are putting profits over patient care, and the executives are laughing all the way to the bank. How would y'all respond to somebody who's the state treasurer making comments like that?
Well, I think a lot of those stories make a good headline, but it's not all accurate. We have one of the most robust charity care policies, and it actually improved for New Hanover when we took over in February of 2021. And we make sure any families that meet that policy get that charity care. As a matter of fact, in a lot of the other programs that we do out in the communities, screenings and stuff that we're getting back to now post-COVID, we're going to be doing more of that. I think we were a little over $1 billion in charity care and community benefit for 2021 of all of Novant Health. So it saddens me that somebody wants to say those comments around already healthcare systems that are already damaged.
The hospital is now back in good standing with federal regulators, and their Medicare contract remains intact. Ann McAdams, WECT News.